Hi everyone, in this video we will be discussing about an important abnormal pulse or pathological pulse, that is pulsus paradoxus. The term pulsus paradoxus is a misnomer. There is nothing paradoxical about it because it's just an exaggeration of physiologically happening phenomenon within our body. So let us discuss about that physiologically happening phenomenon and later about that exaggeration. Generally, when we inspire, the pressure within the thoracic cavity will decrease. So, outside air from the environment flows into the lungs. We know that air flows from high pressure region to the low pressure region. During inspiration, there is decrease in the intrathoracic pressure, which decreases the pressure within the lungs. So, air flows from outside into the lungs. Along with this entry of air, this decrease in intrathoracic pressure also decreases the pressure within the right atrium. It means pressure within the veins is more when compared to the pressure within the right atrium. Due to this greater pressure difference, blood from the veins drain faster into the superior vena cava and inferior vena cava, then into the right atrium. Because of this, there is increased filling of blood into the right ventricle from the right atrium. Just after the diastole of right ventricle or relaxation of right ventricle, there is rapid filling of right ventricle from the right atria. This causes an increase in the end diastolic volume. So we know that according to Frank-Starling law, increased end diastolic volume causes increase in the contraction of ventricle. This increase in the contraction of right ventricle compresses the interventricular septum and left ventricle. So the volume of blood within the left ventricle will decrease as the right ventricle is compressing it. So decreased volume within the left ventricle will decrease the stroke volume and systolic pressure. We know that stroke volume is the amount of blood ejected per heartbeat. This ejected blood enters the aorta, arteries and produce a rhythmic expansion that we are calling it as pulse. So now we can say that there is a direct relation between stroke volume and pulse. So decrease in stroke volume in this case decreases the amplitude and characteristic of pulse. Now we can say that during inspiration there is some fall in the systolic pressure and pulse. In a normal individual, this fall in systolic pressure and pulse is around 10 to 12 millimeters of mercury. When we measure systolic pressure of a normal person during expiration, if it comes out to be 120 millimeters of mercury, and during inspiration if it comes out to be 112 millimeters of mercury, the fall in systolic blood pressure is 8 millimeters of mercury. The fall is not beyond 10 millimeters of mercury. So this condition is considered to be physiological. But when fall in systolic blood pressure is beyond 10 millimeters of mercury, it is considered to be pathological. Consider in a person during expiration, systolic blood pressure comes out to be 120 millimeters of mercury. When we measure during inspiration, it becomes 102 millimeters of mercury. The difference is 18 millimeters of mercury. The fall in systolic blood pressure and pulse is beyond 10 millimeters of mercury. So we can suspect this person is suffering with some pathological condition. This exaggerated decrease in pulse or systolic blood pressure more than 10 millimeters of mercury is called pulsus paradoxus. It is an exaggeration of physiological phenomenon, that is fall in BP less than 10 millimeters of mercury. Most common causes of pulsus paradoxus are constrictive pericarditis and cardiac tamponade. Less common causes are asthma, emphysema, and massive pleural effusion and advanced right heart failure. So, in summary, pulsus paradoxus is fall in systolic blood pressure more than 10 millimeters of mercury during inspiration. In a normal person, this fall in BP is less than 10 millimeters of mercury, which is physiological.